Hi, my name is Mary Steinbach. I'm a nurse practitioner at Huntsman Cancer Hospital in Salt Lake City, Utah. I work in the plasma cell dyscrasia program, taking care of patients with amyloidosis and multiple myeloma.
And my name is Eliza Parkin. I also work at Huntsman Cancer Institute in the same department as Mary. So I take care of myeloma patients and amyloidosis patients as well.
So all patients really deserve a confident NP, right? And that is something having confidence as a nurse practitioner, I think, comes from training. It comes from having supportive colleagues, knowing where your resources are and how to access them. And I think it's what patients deserve. So Eliza and I have practiced together for the past few years. And I think, well, I know Eliza was a new nurse practitioner when she started on her program, started with us. Eliza, what are your thoughts about like how to gain confidence or how to help nurse practitioners have confidence?
Yeah, such a great question, Mary. One, I agree with having really good colleagues. I was lucky to learn from Mary, and she has been practicing for a really long time. And so I was able to learn from her. I think also just being willing to ask questions and not being afraid of not knowing the answer to something. And I think being eager to learn and ready to answer questions and ask questions to your colleagues is kind of one of the things that help instill confidence in me. And, just giving yourself some grace because it takes a while to feel confident, but it will come with time. And so I think that's kind of one of the biggest things for me was, asking questions. So.
Yeah. And the preparation, I mean, even though, yes, I have been in practice for quite a long time, the myeloma space is so different than what it was even 5 years ago, right? So as we were learning bispecific antibodies and CAR T cell treatments here at Huntsman, I mean, we relied heavily on physician colleagues who had the knowledge, experts from other parts of the country who have the knowledge. So I think just developing like a group of persons whom you can contact is very important. And as we got more and more experience through clinical trials and just treating more patients with some of these newer therapies that do have complex side effect profiles, something we really believe in at Huntsman and Eliza and I have done is reached out to the community, right? And I feel like working at an academic center, it's partly our responsibility to train others, educate others, be available for nurse practitioners, PAs, nurses, people out there in the community who may not have the resources or the experience in managing side effects. And so I think really good communication amongst providers. We happen to work at a referral center, and so pride ourselves on communication pathways between nurse practitioners, nurses, and PAs across systems is important, and that helps patients because when people who work outside of the university setting can have confidence and knowledge in providing care for patients with multiple myeloma, then those patients get to stay at home. And that's a really important piece, I think, of care, especially as multiple myeloma becomes a more chronic condition.
We are, I feel like, very good at working with our local community centers um, and talking with them and being able to manage care different states away. And so it really does make such a big difference. I agree.
And the resources that are out there are sort of everywhere, right? If you know where to look. I mean, in day-to-day practice, I use a lot of up-to-date for things I'm unfamiliar with, but the myeloma resources are all over the place. And actually, one of like a really good way to get education is often from our industry partners. So the people who are responsible for the science behind these newer products that we're using often have a lot of education with it. And so listening to those persons, asking for handouts, looking for drug specific handouts can be really very important too.